Hello everybody, welcome to another episode of our Facebook Live session where we talk about matters that are pertaining to the whole journey of wellness beyond weight loss surgery. In today's topic, which is very pertinent to so many of us, that the one thing that bothers them time and time again for anybody who may have had weight loss surgery is weight regain after my surgery. Now, I'll give this in context of gastric sleeve surgery, but this could apply to any procedure that you may have had, whether it's gastric bypass, gastric banding. Let's talk about how weight regain is physiological in certain circumstances and it starts to become pathological in certain circumstances. Let me first describe what is the natural course of weight loss after surgery. This is based on the experience that we have collected now of over 2.5 decades of surgery in my own practice, and also by talking to colleagues, attending conferences, looking at data. Whenever an individual has weight loss surgery, their weight loses dramatically in the first 3 to 6 months. Then it slowly starts to plateau and stabilize until about 12 to 18 months when their weight begins to stabilize. Now, weight regain is something that is normal and physiological when an individual regains about 10 to 15% of their excess weight. Now, excess weight means the weight that is required to bring an individual's BMI down from where their BMI is currently to the healthy range, which is about 18 to 25 points. Now, the percentage that we're talking about is a percentage of the excess weight. The success of any weight loss surgery is defined as when you lose more than 50% of your excess weight. So please understand, I'm not talking about your actual weight, I'm talking about the excess weight, which is the weight that you need to lose to get it from your current BMI into the BMI of 18 to 25. So when we talk about weight regain, there are a few different factors that are involved in the whole process of weight regain after surgery. And I've broadly classed them into 3 different categories. First is technical factors. These are mostly related to me. For example, when I see my data, I realize that in gastric sleeve surgery, we used to use this thing called as a bougie. A bougie is a measuring or a calibration tube that allows us to size the size of the stomach or the sleeve in a way that it remains uniform, plus it gives us an idea how wide it is. Now, it's a very fine balance in the sense that, if I make the bougie too wide, too big, and some surgeons started with a bougie size of 50, well, the patient's weight regain was not as impressive. As the bougie size came down, the weight loss was very good. So, but if you make the bougie too tight, you run the risk of creating a lot of acid reflux. The weight loss will be good, but the individual will have a lot of reflux. So it's about finding that fine balance. So that is in the technical challenges category, so we have to find a right balance for the individual. The second category is your starting BMI. This means that where are you today, as in before you had your surgery, where are you and how much weight loss do you need to achieve in order to achieve your healthy BMI. So more is the distance that is there between where your BMI was before surgery and where it needs to be, greater is the risk of weight regain, because the body is always wanting to achieve where its starting weight was. And the third factor is, I call it the U factors, which means these are the conditions that are determined by you as an individual who is having or has had weight loss surgery, which means how motivated are you? How committed are you to bring the dietary and the lifestyle modifications? Age, now there's nothing much that you can do about the age, but I believe that as we get older, our metabolism slows down. But here is the important thing. There is your biological age, and then there is your chronological age. In chronological age, you may be getting older, but biologically speaking, if your diet, if your nutrition, if your routine of stress management, exercise, and all of that is in balance, well, I can tell you people can reverse as far as their biological aging goes. So these are the three key baskets that we talk about, that we are interested in when we're talking about the topic of weight regain after weight loss surgery. So the way I look at any weight loss surgical procedure is that there are these three key, I should say, criteria that need to be met. Right surgery for the right patient, but very importantly, right kind of follow-up, which means that there needs to be a commitment to ongoing follow-up. And I know people travel, I know people move places, they move houses, and sometimes it's harder to come in person, but that's what COVID has taught us. We can do this follow-up virtually, because what happens is when you follow up, you get advice from a professional who is able to pick up some of the red flag signs. And today I'm going to talk about these 5 key things that we need to understand whenever we are addressing the issue of weight regain. So the first is eating habits. Now people may go for, they say, oh, you know, snacking is not good for you, grazing is not good for you. I have actually made a video which actually talks about grazing is actually something that you need to relook at after having weight loss surgery. Why? Because your stomach is now of a smaller size. It's a baby's stomach in an adult's body. Now, when I say grazing, I'm not talking about grazing on muffins and donuts every 2 hours. I'm talking about grazing or snacking on foods that are healthy between a time period. You've heard me say time restricted eating, which means 8 o'clock in the morning till 6 in the evening every 2 hours. And I personally do this even though I haven't had weight loss surgery. I eat every couple of hours, which means I might be having, say, breakfast in the morning, then I have a handful of nuts, say around morning tea, then I have a salad for the lunch, then I have an afternoon tea, and then I have an early dinner in the evening, say around 6 o'clock. Now after 6 o'clock, I might have a cup of green tea with a piece or two of dark chocolate, and that's okay, but it's not a meal. I'm not having big meals after 6 o'clock. So that is the first thing about snacking and grazing. The concept of snacking and grazing is clearly very important, and it's important to recognize that not all calories are equal. You could get the same number of calories from a donut or from a bowl of broccoli, for example, but we clearly know what source of calories is better for us. I'm not in favor of calorie counting, but I'm conscious of where my calories are coming from. So that's the first thing. Second thing is going for wrong food choices, such as energy drinks, zero energy Coke and Pepsi and all of that, you know, even bars by the name of protein bars. Anything that is coming from a packet has got preservatives, chemicals, and hidden, elements in it, such as sugar and chemicals and salt in it, which is going to slow down your metabolism. Try and eat foods that are closer to nature. That's what is called as whole foods. The third thing is that of alcohol and sugars and sweets. Now, alcohol is not something that is forbidden after weight loss surgery, but I want to emphasize that alcohol is not a health food. Alcohol may be marketed as something that allows you to manage your stress better, but we know it's a band-aid, it's a temporary thing. So have it if you want to socially engage, I've got no problems with that, but have it in moderation. The next thing is that of exercise. Now, I always say that exercise is a very good fitness strategy, but it's not a good weight loss strategy. Have an exercise routine for yourself. 15, 20 minutes, 25 minutes, preferably have an exercise physiologist or a personal trainer who can carve out a nice program for you that can work with your schedule. And that is where I would say that you need to incorporate. There's no need to spend hours and hours in the gym to be able to kind of, bulk up so much that when you get so tired or when you get injured, you just stop it altogether. So that's going from one extreme to the other. And the last and perhaps the most important thing that we look at is that of your emotional state, which means your mindset. Now, a lot of people say, mindset is really a very individual thing, or I don't understand it, or it's too hard, or they might have an excuse or a definition for themselves. But I tell you, we love, as human beings, we love to complicate things a lot. I think we should genuinely make an effort to simplify things for ourselves. And you know what? If you ask the right questions, the right answers will begin to emerge. So, very importantly, making a commitment to yourself that you will respect yourself. You will put the foods in your mouth that will allow you to embrace a better version of yourself is the starting point. If you are buying or getting in lollies and sugary drinks and other such things in the house, well, they're not just appearing by themselves. There is something that is driving in you to get those things. There was a very small study that was done that if you went out shopping when you are hungry yourself, you land up picking up in your shopping trolley all the things that are sugar laden, convenience foods, easy foods, and all of that. So just a small little advice there, that don't go for your supermarket shopping when you are starving yourself. Not a good idea, because you will land up picking up things reflexly. It just happens reflexly. So those are small little things. When you start to work on it, you realize, you know what, my emotional state is determining my physical state. So that is where it is critical to understand that whatever lifestyle behaviors you are demonstrating are reflected first in your mind. So you've got to go there and see what is causing me to make these unhealthy choices. I always get this question, has my sleeve stretched? And is that the reason for my weight regain? And I can tell this to you that there are certain surgical factors for that, which can be checked up based on, and we get patients off and on who may have had sleeve surgery or other forms of surgery done elsewhere. And there are technical reasons for that, which may cause the pouch or the size of the sleeve to increase, in which case they may need revisional surgery. But then there are, as I said to you, you factors, which is your mindset shift, your lifestyle shift. And this is where a whole holistic approach around approaching things in an integrative way comes in. Our psychologists, our dietitians are here to help, but you need to ask for help. As they say, God helps those who only help themselves. So I would urge you to think about the concepts and the points that I touched upon in this video, because they're really pertinent to anyone who's experiencing some weight regain issues after having weight loss surgery. And if you are not sure as to what's happening, perhaps it's time for a catch-up with your bariatric surgeon and the team. Take care and stay safe.